So here's some of the tools in the toolkit. And you can have a toolkit. Therapists that work with kids will have, whether it's teenagers or little kids, they'll have a container, and into that container the kid puts the tools that they know they can use. So it might be reminders of what the skill is, because if it's relaxation training, you obviously aren't putting that in the box, but you might have like a card that reminds you, it has a picture that reminds you of your relaxation. So the first category of tools is looking at tackling this worrying thing. Because we know anxious people are extremely good at worrying. It's the skill that we all have that we could, if I could make money out of it, I could be a millionaire. So what we know is worriers don't forget any of the bad things. It makes it easier for us to worry. I don't know if you know people who are just not worriers. And you can go through the same bad experience, and a few months later, you haven't forgotten any of the details of that bad experience, and they can't remember them. And you'll think, how could you have done that? Well, they're just not anxious people. So it does not stick with them the way it does with us worried and anxious people, and that's true for kids as well. So what you need to do is come up with some ways that they can deal with those anxiety-provoking thoughts. So when they get that worry and they start fixating on it, what are the replacement thoughts that they can come up with? So that's coping self-talk. Once again, this stuff is all in these resources that you're going to have access to. So think about how you calm yourself down. That's what coping self-talk is. So I think it's always helpful to think about the times when you've done it, the coping self-talk, and how it worked and how you felt, and the times when you leaned over into doing the I'm going to make myself feel worse talk. The easiest example of this is the road rage thing, right? So you can be, or angry people generally when they do those responses. So I can do it myself. Someone cuts you off, or for me, the quintessential worst thing that can make me say negative things to myself and make myself angrier would be you're driving, I'm sure you've had this experience, the person in front of you is driving below the speed limit. The road is good, the vision is good, there's a light coming up. If they would just go the speed limit, you'd both make that green light. But they don't. Indeed, they tap their brakes as they approach the green light. It turns yellow and they go through. You're sitting at the red light. So you have a couple of options in your self-talk. If your self-talk is the rageful responses, which I won't outline, you're going to get madder, right? If you go, oh, this too shall pass, it's a 2-minute light, am I going to die? No, I don't think so. You can calm yourself down. Another one to do is, I probably have done that myself, daydreaming, and done it to somebody else. Anxiety is the same way. You start to be anxious. If you start to tell yourself the anxiety-provoking thoughts, this will never be better, this is the worst thing ever, I'm so stupid, it's always going to be this way, it'll never get better, your anxiety gets worse. The coping statements are the things that you would model that would help. And so here's some kind of realistic thoughts. So here's anxious, I'm going to fail the test today for sure. So I'm scared, I'm worried, I'm tense. And my anxious behavior might be to blow up, be really irritable, have a temper tantrum, avoid school. That's my anxious behavior. A coping kind of process would be, I studied, I know lots of information, it's just a test. One of the key things to do is to say, what's the worst that's going to happen? So I might actually be able to get all my thoughts down on paper and do quite well. I've done it in the past. If I don't do as well as I'd like, there'll be another opportunity. So it's those kinds of realistic thoughts. Realistic thoughts help you to be more calm. So you kind of work through with the child around, if you were able to think that, and when you've thought it in the past, how did you feel? And then the coping behavior. You're going to be more likely to be able to go to school and focus on the test and do what you need to do. So there's all sorts of positive coping statements. And what I would advise is it's oftentimes helpful as you have this kind of discussion to personalize them for the child, and they should have them someplace where they're reminded of them. So anxious young people I've worked with will have them, like a boy would have them in their pocket, girl in the purse. If you know you're coming into a situation and you start to hear those automatic anxious thoughts, you can pull that out and have it on your desk at school. Nobody needs to see it. And you remind yourself of what you're supposed to be thinking. It gives you an alternative, and you can start doing that work. Some of it is reminding yourself of situations that you've handled well in the past. So that's reminding yourself of your competencies, right? Then also challenging yourself about those negative thoughts. What's the evidence? So if you're generalizing to a huge catastrophe, do you really have evidence that every single time you try this thing it goes badly? That every single time you don't answer a question right, the entire class lies on the floor laughing and they all call you names for the rest of the day? So it's pointing out to people that anxious thoughts are huge, huge, huge catastrophes, and you don't really have evidence to support it. The other thing you're going to be working on with an anxious person in your family is ways to calm themselves down. So you know how some people have infants that seem to sleep through the night all by themselves. They come home from the hospital and they go to sleep, and parents will even say they have a hard time getting them wake up to feed. And then usually as parents we take credit for that. Those of us that didn't have that child are in the background saying, no fair, right? I'm sure I didn't do anything wrong. So what I would say to you is anxious people, anxious children, are not innately, automatically, really good at calming themselves down because they're hypersensitive. So if you're reacting all the time, it gets very hard to just automatically know how to calm yourself down. So I know, situations when we work with groups of kids where, one child is the reactor, is the sensitive child, and they're flooded all the time, and they watch with amazement while the other child is in the same situation and has an initial response, but it's like water off their back. They just roll off and keep on going. So we're teaching our anxious kids how to soothe themselves. We do it in a couple of ways. One is showing them how you do it. So we are seeing more and more anxious children, and I think some of the reasons for that are to do with the level of pressure that all families are under. I think that's for sure true. So we as parents come flying in the door. We're panicked about a lot of things. Many of us are worried about money and bills and jobs and needing to do the best you can to hang on to the job you've got, and so on and so on. And you come in and you're just like this, right? If the house is just like that and you're an anxious child, you're going to be just like that. You're not the kind of kid that can go, oh, well, not going to pay attention to mom and dad tonight. They're kind of spun. You're going to be spun along with the mom and dad. So unfortunately, it means more intentional modeling on your part and structuring your routine at home so that things are calmer. That's key. So there needs to be a peaceful routine for the anxious, and it needs to be predictable. Us anxious people will create a routine. If I'm in a situation where I create a routine on a vacation. I need a routine. So anxious kids need that routine, and if it's going to be varied, you need to prepare them for it. And they need to see you modeling looking after yourself. So if you've had a horrible day and you stagger in the door, it's okay to say, what a day. I'm just ready to snap, and it wouldn't be fair, right? Makes me irritable, and I could yell at you and it's got nothing to do with you. So just have the freedom to be able to tell kids that. We don't tell them by coming in and shrieking and hollering, right? So it means we have to be aware of that. We have to try and make sure we're building in slow times, not frantic all the time for these kids. It's probably good for everybody. But the other thing you need to do is actively coach. So relaxation. I don't know if any of you have ever done visualization exercises or just even deep muscle relaxation. That's a key thing to do. And it's fun to do, actually. And particularly fun if you include visualization in it. So that, for little kids in particular, is just really fun for them to do. So if you have a bedtime routine that includes a warm bath and then, the brush the teeth, read a book, you can incorporate, and now we're going to do some relaxation. And so there's lots of sites and there's CDs you can get, but the key elements are to tense and relax muscles, because we know that if you tense a muscle and hold it and concentrate on it and then relax it, the process of that muscle relaxing feels mighty darn good. We know that if you practice tensing and relaxing muscles, it's very hard for your breath to get escalated, for your adrenaline to rush if your muscles are relaxing. So that's how it works. The other part to include is, where do you take your brain to? So you want to have a visualization of a relaxed place. And you want the child to elaborate that relaxed place. And then in their toolkit, they need something that reminds them of their relaxed place. So I used to buy those things that you'll see sometimes at, even at the Max and those places. They'll have they look like they're pewter, but they're not, and they might be like an animal or an angel or a little message. It's something that then you imbue with that relaxation. So you create, one of the women I worked with had an anxious son, and she would do that routine at night, and then the other thing they would do is they had like a hand signal they did, and then he could go to sleep. The bottom line is you're taking that visualization to a place where they can go there easily. My daughter's was, she was floating in a hot air balloon, and she was flying up into the sky, and we had the sun and the color of the balloon and the sound of the noise of the balloon and who was in the balloon. It was hard for me describing this with her because I was thinking we're in the air and this isn't making me feel really good, but she's not afraid of it. So you need to think of that and make sure, even for adolescents, that they're doing that. Don't let them say this is silly or beneath me. It's a key skill. Positive self-statements. We've gone through these anxious traps. And there's your toolkit. So in the toolkit, we've got positive self-statements, coping self-statements, the thing that reminds them of their relaxation and their peaceful place. And they've got what they're working on. So what's the step on that fear ladder that they're on? And they could even have that fear thermometer. So what you're trying to do is give them skills, right? The other message, before we get into, like, what do you do? How do you know if this is a situation where you need to get more professional help? There are all sorts of kinds of anxiety diagnoses, and one of them is generalized anxiety disorder, and it's a pretty common one. And it's easily described. It's the excessive worrier. It's Woody Allen. It's the person who is in a conniption all the time, worrying about something. And then there's the separation disorder kids that can't be apart from a parent or caregiver. If that separation disorder persists into middle childhood and adolescence, it's when it would get this diagnosis. There's the social anxious kids, the kids that are horribly, horribly shy. So they wouldn't be so bad about getting in the pool or, getting up on heights and those kinds of things, but they're going to be really horrified if you stick them in a situation with a bunch of people and they have to interact. New people, crowds of people. Then there are the specific phobias that kids have. And the bottom line for phobias is they're a big problem when they get in the way. So if you're terrified of black widow spiders, it's not going to get really in your way unless every single spider you see you're convinced is a black widow spider. And then that can grow into you can't function. So it's just important to know that we probably all have phobias. I'm not looking to travel really to Australia because I'm pretty sure a snake would fall out of a tree on me, but it doesn't get in my way particularly. So keep that in mind when you're thinking about, is this really that bad, this childhood fear? And then there's the panic attack version of anxiety. Kids that have had a trauma, just like adults who have been through a significant trauma, can experience post-traumatic stress disorder, and it presents with anxiety. There's OCD, and OCD is something that we see more and more of in the media, and it's an anxiety disorder. And that's just giving you an idea of what it is. It's recurrent, excessive, and unreasonable thoughts, obsessions, and compulsions, and they're the behaviors. And they cause marked distress, and if you interfere with the performance of the behaviors, the distress escalates. So that's basically what OCD is. And, not to go into any big details, but they will be kids that have to wash their hands over and over again, or have to count or tap, or keep going back and checking. It's that kind of behavior. So I'm not going to spend a whole lot of time going through the details of it. It's important with OCD symptoms to remember to think about it as a possibility, because sometimes it can present as an unwillingness to comply. So it might be the child that doesn't get anything finished. And is it because they don't feel like it, and they're just being difficult and not complying, whether it's in classroom or at home? Or is it because they keep having to redo it? Or they see a number 5 and they can't move forward until they've gone backwards and redone it a few times. So you just have to think in terms of, is this an anxious child anyway? And what other things are you seeing? Red flags for anxiety problems in the classroom include things like these. So it's the, easily distressed, reassurance seeking. They do that with teachers as well. Incomplete, not turning things in, not showing up the days of tests or the days when there's a presentation, not being able to really pay attention because they're swallowed up in their anxiety. There's lots of things that teachers are aware of and look for. And then these are the red flags around OCD. In the interest of time, I won't spend a lot of time there. One of the things to think about, and parenting is just such a battle of trying to figure out how much is too much of anything, but we want our kids to work to their potential. And you want to encourage a desire to do that, to excel to your potential. Well, that's the real challenge, isn't it? Because the other part is you don't want them to feel like they have to be perfect. And we do see a fair number of anxious kids doing this I have to be perfect version of things. So the challenge as a parent is to help them to understand that everybody messes up and it's okay to mess up. And what did you learn from messing up? And is there anything you could do differently the next time? It's really important for them not to get the message, and we see it in adolescence. And I think, I think maybe we're doing it more as a culture and the society is feeding into it because it's so hard to get gainful employment. And it's so hard to figure out what training you could take that would get you a decent job. And so I think we're seeing more and more kids feeling like if I don't get 99.9, then I'm not good enough, it isn't perfect, and things aren't going to work out for me. So it's important as a parent, I think, to try and really emphasize a balance, really. So now this is the relaxation thing we've done. If you get to a point and you have an anxious child or adolescent and you've tried things and you're not really feeling like what you're doing is making a difference, and the anxiety is interfering in their ability to do normal daily activities of being a kid, then you're going to probably want to seek therapy. And there's kind of a 2-point decision. But the first thing you need to know is that if you're seeking a therapist, someone that you're going to bring your child in to work with, so not a medical doctor, you want to make sure they can do cognitive behavioral therapy, because insight-oriented psychotherapy will not help anxiety. It just won't. We know that, and we do know from research that for mildly and moderately anxious people, cognitive behavioral therapy with no medication can be as effective as cognitive behavioral therapy with medication. But we also know coming in and talking to somebody about what bothers you isn't going to make any difference. So we need to make sure that people know how to do it. And it's that triad. So you're going to have, if you do that for your child, you're going to probably come into some of the sessions, and that therapist is going to teach you what they have been working on with your child or adolescent, and you'll know what the homework is. Because the thing about CBT, as opposed to regular old-fashioned therapy, is it's a lot of work that has to be done when you leave. We've had giggles at work because a young person will come in, an anxious kid, and we start in, what's your goal? And then what you would do is you would go into your family doctor and ask for a referral to child psychiatry. We're in a position in our community now where we have 6 of those specialists. A decade, well, less, 6 years ago, we had one 78-year-old guy who came over 3 days a week from Detroit. Bless his soul, we loved him. But we managed to recruit, and we've got all these young child psychiatrists, and your family doctor can refer to them, and the wait list isn't that long because there's enough of them. And it's a service covered by OHIP. So that's what you would do. So if I were considering medication for my child, an anxious child, that's what I would do. Family doctor, referral child psychiatry. They might not necessarily prescribe medication, but they'll meet with you, meet with your child, give you the diagnosis, make a recommendation, and they might instead say to you, try CBT. Try this first before you try medication. They could well say that, and it will be dependent on diagnosis and level of severity. And there's the resources, and I think Tracy is going to email that stuff to you guys. But I can't emphasize enough that the message that in doing this with your child you're giving them is it's okay to be anxious, and there are things I can do to deal with it. And it's not like my goal is to stop being an anxious person. My goal is to get in charge of my anxiety so that when it starts to rev up, I have some things I can do that get it back under control so I can manage it. And certainly for you here, I bet you some of you are anxious people, and I bet you're sitting here thinking, well, that's kind of what I've had to do, right, in my life. So that's what you're teaching your child to do. So does anybody have any questions at all? Yes? I'll get you next. Yeah. Yes. Well, you know what? I don't know him, so I can't answer for you. But one of the things, I guess, is to figure out what's the difference between the dance and the wedding, or the thing he seemed to be able to do, and you'd think it was the same thing, basically, and the thing he didn't. Because there may be a motivational factor in it, maybe, so that that could be what's contributing to the problem. There's some excellent workbooks for kids who are higher functioning, you know, Asperger-y kind of kids. And the fellow's name is Atwood. And it's just a workbook the person can do for themselves to kind of try and sort out what are the things, what can I do, I got to do this thing. You may not want to, how can I manage it? So you could try, he's Tony Atwood. Oh, okay. Do you know what? I have a copy of this page, a hard copy, and before I go, I'll give you my hard copy, okay? Anything else, you guys? Yes?
CBT, help, would that be referred to the doctor too? Was that a child psychiatrist? Is that a counselor?
To get CBT, it's not a doctor, because unfortunately the child psychiatrists don't have time to do therapy, right? There's a huge volume for other purposes. So could be social work, could be psychology. There's Windsor Regional Children's Center, which is funded by the government, outpatient service. Many EAP plans, if you're not going to go that route, will cover social work and psychology, and you just are finding out whether those people have that training. There's a tiny outpatient service at Maryvale that the child psychiatrists refer anxious children to. So that's another source. But it isn't the doctor. And those people, those disciplines, don't need a doctor referral because we can't bill OHIP. Anything else, you guys? Thanks so much. Good luck with your kids.